Respiratory system diseases. Bronchitis is an inflammation of the lower air passages. It takes place when the bronchi, situated between the lungs, come to be irritated because of infection or for other reasons. According to its duration and etiology, a distinction is made between acute bronchitis, of short duration, and chronic bronchitis of long duration. Causes. Bronchitis typically complies with a respiratory system infection. At first, it impacts the nose and throat, then spreads to the lungs. In some cases, one can obtain one more secondary bacterial infection in the airways. This implies that, in addition to viruses, microorganisms infect the airways. People in jeopardy for the acute respiratory disease include elderly, children as well as young children, people with heart or lung conditions, smokers. Symptomas y signos. Signs and symptoms include coughing with mucus, often bloody. The mucus may have a yellow-colored green pigmentation, yet this does not indicate that the infection is bacterial. It also appears the exact same in viral infection. Inflammation of the bronchi, ramifications of the airways between the throat and the lungs. Inflammation, edema, of the bronchial wall surfaces. Lungs obstruction. Beeping or wheezing. Fatigue. Bubbling. Describe the audio result that is seen when the patient is auscultated with a stethoscope. Breathing difficulty. Hoarseness. General pain. In persistent bronchitis, the following signs may also occur. Swelling of the ankles, feet as well as legs. Blue staining of the lips caused by reduced blood oxygen levels. The propensity for respiratory system infections, such as colds and also influenza. Treatments. If bronchitis is considered to be a microbial disease, which is very unusual, appointment required. It is treated with antibiotics. In asthma instances, inhalers are often made use of to avoid suffocation, bronchodilators, or inflammation, steroids. For cuts in breathing, dyspnea due to bronchospasm, a salbutamol rescue inhaler is generally utilized. There are other inhalers that can be recommended for day-to-day usage. Related diseases. Inflammation of the minor airways, the bronchioles, is called bronchiolitis, and it is a very common viral infection in young children. In 5% of cases, bronchiolitis can be caused by bacteria. Chronic bronchitis is one of the clinical manifestations of COPD, chronic obstructive pulmonary disease. Another manifestation of COPD is emphysema. Natural remedies that can cure bronchitis. 1. Water and salt. Ingredients. 1 glass of water, 200 milliliters. 2 tablespoons of salt, 20 grams. Preparation. Boil the water. When it comes to a boil, remove from the heat, add 2 tablespoons of salt and mix well. Take a drink without spending too much time and gargle for 1 minute. 2. Lemon juice. Ingredients. The juice of 1 lemon. 1 cup of water, 250 milliliters. Preparation. Heat a cup of water and add the juice of 1 lemon. Mix well and wait about 5 minutes before drinking it. 3. Eucalyptus. Eucalyptus can be a good natural remedy to try to calm bronchitis. According to followers of alternative medicine, the properties of eucalyptus make it one of the favorite plants of naturists, since it has expectorant, antibacterial, and decongestant effects. Ingredients. 4 cups of water, 1 liter. 1 tablespoon of eucalyptus leaves, 10 grams. Preparation. Bring 1 liter of water to a boil and add the eucalyptus leaves. Let the decoction work for 15 minutes. Drink 3 times a day and you will notice the improvement. 4. Oregano. According to popular wisdom, considers that oregano can help improve some symptoms of bronchitis. However, its use is not endorsed by health professionals. Ingredients. 4 tablespoons of oregano, 40 grams. 1½ cup of honey, 500 grams. Preparation. First, place the 4 tablespoons of oregano in a pan and cook over low heat. Then add them in a bowl with the honey and mix well. Discover 3 tricks to decongest the nose. 5. Mallow. Another solution that could help against bronchitis, mallow. It is believed to have anti-inflammatory and expectorant properties that may contribute to relief in the case of bronchitis. Ingredients: 5 tablespoons of mallow leaves, 50 grams. 4 cups of water, 1 liter. Preparation: add the mallow leaves and water in a saucepan and bring to a boil, approximately 20 minutes. Sweeten to taste and drink 3 cups a day. Although they do not have a trusted clinical basis, at a preferred level these treatments are often advised for the treatment of respiratory disease.